In the developing world, there's a lack of access to healthcare for mothers and their babies, which can have tragic consequences. For more than 2 decades, Adara has worked in maternal, newborn and child health, delivering deep service, sharing knowledge widely and showing what's possible for communities living in remote and low-resource settings. In 1999, the Adara team went bumping down the red dirt road to Chaco Hospital in central Uganda. We formed a deep partnership. At its heart has been the development of Chaco's first neonatal intensive care unit, the NICU. Now, more than 1,200 babies receive care in this NICU each year, and in 2018, the Ugandan Ministry of Health named it a Centre of Excellence in Newborn Care. From many years' work in the NICU, we've learnt the interventions that can have the biggest impact on some of the tiniest lives. When newborns experience respiratory distress and are unable to get enough oxygen, it can be fatal. For premature babies, this is the leading cause of death. So, Adara has worked closely with Chaco Hospital, PATH, the University of Washington and Seattle Children's Hospital to design and trial a low-cost, continuous positive airway pressure kit, commonly known as CPAP, a device which uses gentle air pressure to keep an infant's lungs open. As 100% oxygen can be toxic to babies' eyes and brains, the CPAP kit includes an oxygen blender to ensure these fragile babies receive the ideal levels of oxygen. This device could save tens of thousands of lives in low-resource settings each and every year, as crucially, these units can be operated without power. Hand in hand with Chaco, we also support a maternity ward that cares for more than 3,000 women each year. Our support for newborns and their families continues after they leave hospital through our Hospital to Home project. Hospital to Home starts by strengthening discharge processes inside the Chaco NICU. The support continues through a network of community health workers that provide ongoing care to families at home for 6 months after discharge. Now we have a chance to identify issues and intervene early, giving these infants the opportunity to survive and thrive. Working with Chaco, we host monthly safe motherhood clinics, giving access to antenatal care, family planning and immunisation services in the community. The program also works with community health workers who create a bridge between the community and the formal healthcare system. We are also trialling a community-based early intervention program delivered in small groups to young children who are living with a disability. The project is called Abana, and we're working with our collaboration partner, the London School of Hygiene and Tropical Medicine Uganda Research Unit. The training is focused on empowering caregivers by increasing understanding of their children's needs. Thanks to 20 years of learning and growing with Chaco Hospital, we're now taking our knowledge and expertise in newborn care and sharing it with other facilities. We've begun piloting a newborn training project with nearby Nakaseki, the only public hospital for a catchment area of more than 1.7 million people. Already in the first 12 months of Nakaseki's new special care baby unit, 517 babies have received care, with a remarkable 99% survival rate. Together, Adara and Chaco Hospital are working alongside the Ugandan Ministry of Health to provide support, guidance and advice as they develop more neonatal units across the country. We will do our best to support and equip them with theoretical knowledge and practical skills to save more newborn lives. Our work is only just beginning, and we have huge plans to expand our reach, because we believe that every mother, every newborn, every child, and each and every person deserves access to quality healthcare, no matter where they live. Come join us.